My name is Fernando Holguin, and I'm an associate professor of medicine and pediatrics, and I'm the assistant director of the Asthma Institute at UPMC and the School of Medicine. The ICU environment is a complex environment. It has a lot of movement, a lot of whistles and alarms constantly sounding. I think it's a stressful environment for patients and for their families. So for someone in that environment who doesn't know the language or comes from another country or has different cultural background, the environment could be even so much more stressful because they don't understand what the nurses are talking about, what the doctors are saying. You know, a common way to open a conversation is to ask, what are their expectations? So I think asking relevant questions about beliefs, expectations, gives you an idea of where people are and how you need to proceed and move forward. If you have a family and they feel comfortable talking to you, they will be more likely to open and share fears and expectations. And then when you make a decision, you'll be able to do it in conjunction with them and what's the best decision for the family member and for them. One example of where you need to have cultural sensitivity is the one that you're mentioning about regarding a young Muslim patient that had come from another country. This patient was fairly ill and was not conscious, but a lot of the communications happened with their family. And it so happened that he had a large beer that needed to be treated with a topical medication. And of course, treatment of choice would have been to shave the beer. But we couldn't do that, and we learned that through communicating with the family on multiple instances that the beer has a profound meaning in their culture. So if we had done that, it would have made the family felt not understood and not well received. And so I think it would have complicated things in a much greater way. So we worked with them and we treated it multiple times as best as we could without shaving the beer.